And I said, come over, just come on over, you'll say.
Good morning, ladies and gentlemen, and welcome to the Town of Portland podcast. I'm your host, Dave Kosminski. We're here live at the Town Tech Educational Podcast Studio at Portland High School, and it's a little bit lonely up here. The halls are empty and so forth. But with us today on the line, we have our first selectwoman, Miss Susan Bransfield, and also our Chatham Health Director from Chatham Health District, Mr. Russ Melmott. And this is going to be our episode number 27. So welcome, Russ, and welcome, Sue. And I think, Susan, take it away.
Oh, good to be together, even though we're acting remotely. We are practicing good social distancing, and that's always important. I know that Portland, our numbers are up as far as incidents of COVID-19. Looking forward to hearing what you have to say, Russ, in terms of how we can continue our efforts to fight this disease and do our best to not spread any more than what is occurring as our weather is changing and as our gatherings have changed. There's so many things that we need to learn and practice from you, so I look forward to hearing a little more from you.
That's great.
Some good news. The town was recently awarded a grant for homelessness prevention, and there was a nice article in the River East that talks a little bit about this grant. It's something that I know Portland has been committed to for many years, and that is to help those less fortunate, and in particular those that find themselves without a home, to access some resources. We partner to a great degree with the city of Middletown in terms of trying to help people. I work with Mary Pont as well as Michelle Sapagli in my office to help people, whether it's helping them find fuel, helping them access the Portland Food Bank, and also now being able to access a grant that will help us increase our coordination on a regional basis with the city of Middletown, Meriden, and Wallingford. It's called a Coordinated Access Network that we will put our resources together, be able to hire some social workers that will assist us in identifying those that are either on the brink of homelessness or are already experiencing homelessness, and find them the resources that will allow them to find appropriate housing and also supportive services that will assist them with either health care needs or education or other types of social requirements that aren't being met for them. So it's something we're looking forward to being the lead on, and I'm very happy that the State Department of Housing has awarded Portland this grant to help us as a region to help folks that are in need. So that's something I look forward to talking a little bit more about as we get more information from the State Department of Housing, who has awarded this grant, and hopefully help some folks.
Sure, that'd be awesome. Geez, I think October and November has been like Christmas for the town of Portland. We got our $250,000 grant from DPH for the water system updates, and now this. So this is awesome.
Yeah, and also, Dave, in terms of water, we also received a $126,000 small town economic assistance program grant that will help us replace a water main in the area of Brownstone Avenue and Lower Main Street. It's an area where we have experienced frequent breaks, and I think even our health director will certainly be happy that we're able to fix that main. Safe distribution of water is very health conscious. It's a very important aspect of our infrastructure and our health needs in terms of public health in Portland. So yeah, it's a culmination of your work, Dave, the work of our finance director, Tom, as well as Bob, our Department of Public Works, and just coordinating with our state officials. Christy has been great help to us, as well as Norm Needleman. Again, working together to hopefully meet the needs that our communities have.
It's a team effort. That's what it's all about.
Yeah.
Absolutely, absolutely. All right. Is there anything else, Susan?
Well, certainly a happy Thanksgiving to those who are listening, and hopefully that Thanksgiving is not just one day of the year, but it's something that we practice throughout the year. And that's certainly the way I'm looking at it this year. We're going to be very quiet. It's just my husband Tom and I will be having dinner, and we'll certainly be very thankful for all God's blessings that we have, and do it every day of the year, because certainly there's a lot to be grateful for. In the midst of troubling times, we always find those things that we're thankful for, such as our family, our friends, and our health director, Russ Melmed.
Absolutely,
There's
and
a segue.
I'm sure Russ is going to have a few words to say about family gatherings this week. And before we turn it over to Russ, kudos to you, Susan, on championing the effort of working with not only Russ but Mark Maselli at the Community Health District in Middletown, and making that pop-up Corva testing clinic at the Library Senior Center happened this past Saturday. I think it was overwhelmingly very successful, and again, kudos to you for making that all
thank you,
together.
Dave, for showing up early and bringing those extension cords. It's those little things that count, and thank you very much for being a team player and helping us get that set up. They were fantastic. CHC is a wonderful resource in the greater Middletown area, and I can't thank them enough, along with you, Russ, for helping us get that testing site set up and run so efficiently.
Sure. It was really a great success. I hope we can do more.
Oh, we'll be right there with you. Thank you.
Sure. All right. Russ, again, thank you again for all of your efforts in coordinating with CHC happen. And so give us the update.
Sure. So since we're talking about the CHC testing clinic we had on this past Saturday, from what I understand, it was a great success. The operation went very smoothly, with perhaps the exception of some cars queuing up on Freestone Avenue, blocking a driveway here and there. I understand it was a very good operation, very smooth operation, very important. And I think we're seeing, with regards to testing around the state for COVID-19, a tremendous demand. And I think the demand is there because, at least in part, the message is getting out that it's important to get tested even if you have mild symptoms, or even if you have no symptoms but you know you were around somebody who has COVID-19. And the other thing I think is driving the surge in the last week or two is people wanting to get tested before Thanksgiving. And while perhaps on the surface it sounds like a great idea, I am concerned, at least in part, because I don't want people to think that a test that they got the week before Thanksgiving that was negative means they're free and clear to go with some multi-family, multi-household big Thanksgiving feast. Benefits to having testing before Thanksgiving, in my mind, is limited to only identifying people who have COVID-19, so that if they were planning on Thanksgiving meal with other people outside their household, they can cancel it. They can say, okay, I tested positive, let's cancel it. But really, I think the message that I'd like to get out there is testing is great for a snapshot in time, for you to understand at that moment on that day if you have a detectable infection in your body. And so you can let everybody know who you were in close contact with, as far back as 48 hours before you got that test taken, that you have COVID and that they need to quarantine and get tested because they were around you. So for those of you who are listening, who are thinking about having a multi-household Thanksgiving gathering, I just want to encourage you to rethink those plans. Because what we're seeing right now in Portland and everywhere in the state of Connecticut is a resurgence of COVID-19 driven based on the contact tracing that we're doing, driven in large part by small social engagements with people who you know and trust, friends and family largely. And we're not talking about the big, huge gatherings that were occurring over the summer, which really didn't seem to drive, especially since they were outdoors, much transmission at all. We saw big, farmers markets occurring and concerts on the green, and all these things we're having over the summer were great. We didn't see that contribute to COVID-19 at the time, and we're still not. What we're seeing are these little gatherings people have at their house. And as it gets cold and it's driving people indoors, that's a much higher risk environment. When you look across the table or across the room or across the fire pit at somebody who you've known for many years and you're friends with, or your family member you've known your whole life, you may be apt to think that that person does not represent a physical threat to you or anybody else. But in fact, it's quite the opposite. What we're finding is that people within households and at these small social gatherings that bring people together from other households, those are far more likely to transmit COVID-19 than people who you might pass by in the grocery store, be waiting in the aisle, the checkout aisle with.
Sure.
Those people are less likely to transmit, principally because in those settings, those encounters are brief, and everybody is following all the recommendations and requirements that businesses have right now for patrons and staff to wear masks, stay 6 feet apart. When you get together with people that you know and you love and you trust, after an hour or so, you start to sort of let your guard down a little bit, especially when alcohol is involved.
Mm-hmm.
And we all know that on Thanksgiving, what goes along with the turkey is alcohol and football. So,
and naps.
Yeah, exactly. And so I think we're looking at those moments of joy and celebration that bring people together as things that, unfortunately, we need to discourage.
Sure.
This time.
Sure. That's
we're seeing an acceleration in Portland and everywhere. And I'll just give you by the numbers. We look at 2-week averages of cases, and over the summer, over the course of 2 weeks, we were really seeing in Portland 1 or 2 cases. 1 or 2 every 2 weeks.
Mm-hmm.
And on October 29th, we saw 10.
Wow.
For that reporting period. Then the next week, November 5th, we saw 16. November 12th, 25. November 19th, 34.
Wow.
And so that's what an acceleration looks like. It is more new cases every time we report than we had the previous reporting period. That's acceleration.
Mm-hmm.
A flat curve would look the same number of cases every reporting period.
Mm-hmm.
And a declining curve would see fewer new cases every reporting period. So we're on the upswing. We're on the bad side of this curve. And though I don't want to indicate to anybody who's listening that there is some inevitability about this, there is not. There's nothing inevitable that says we will get more cases in the next 2 weeks and more the next 2 weeks. It really comes down to people's behavior. Yeah, we have models that suggest that we won't see the peak of this curve in Connecticut until mid-January. It's a very scary thought when we're only at the end of November, and I just gave you those numbers. So if you project a further increase over the next 6 or 7 weeks, what that might look like.
Right.
So those are models. The models use inputs that are based on assumptions about people's behavior.
Sure. Yeah.
So it's not inevitable.
Right.
We do the right things. We don't get together with multiple households over Thanksgiving, then we can bend the curve. I mean,
sure.
This is this is not a sunrise or a sunset that's going to happen no matter what. I mean, the sun does not have to set on the town of Portland when it comes to COVID-19 for the next 6 weeks.
Right.
It can change the trajectory.
Sure. And I think too, Russ, because of this trajectory, obviously not only Portland but a lot of other school districts have had to react, and I think most school districts now are kind of either migrating to the hybrid mode or the remote mode as far as that goes, and again we'll see how that transgresses into the numbers going forward.
Yeah, we do see some, especially high schools and middle schools, shifting towards a hybrid mode because contact tracing especially seems to really hit those environments very, very hard when a case comes in to a school, because cohorting, that thing that keeps students together and not mixing across different groups, it can't really be done successfully in high school. Students kind of have to go to their different classes, different levels of each science, math, English, social studies, things like that. There's a lot of mixing in high schools, and so when you have one case that goes into a high school, they might have been infectious for a couple of days and had 8 different classes, you could impact 100 students very easily from one case. And so
right.
I think that's what we're seeing, especially in high school, middle school. Elementary schools seem to be maintaining, the vast majority in the state of Connecticut are still all fully in person, actually.
Mm-hmm.
I think somewhere in the area of 60% of elementary schools are all in person, and that's for 2 reasons, I think. One is the success of cohorting. So you can keep elementary school students in one classroom and not have them mix across multiple classes. So when you have one case that comes in, the maximum number of people you might in the end have to quarantine is really limited by the number of students in that class. And the other thing is we've seen that young people, even though they are capable of reproducing the virus in their nasal passages, their upper respiratory tract, just as successfully as others, the older adults, they don't seem to be very effective at spreading it amongst one another.
Mm.
So for whatever reason, maybe it's because they're closer to the ground and their respiratory secretions don't go as far and they just hit the ground. They just don't breathe as much or as heavily. For whatever reason, we are seeing some success in those settings of keeping case numbers, transmission down. And we're really seeing that success in most schools and most school districts when there's a case. So the numbers who we have to quarantine are pretty high, and it certainly causes some administrative disruptions, and staffing becomes an issue. And if you've got 30% of your students out because of quarantine, does it make sense to continue opening school? I mean, that's one question I think a lot of schools are dealing with, including Portland. But we're seeing limited transmission, very, very limited. So when we see a person come into school and have close contacts and you quarantine 60 people, we've really only seen 1 or 2 transmissions as a result.
Mm-hmm.
So that's because of the tremendous job that our schools are doing with implementing mitigation strategies like mask wearing and HVAC and cleaning
Sure.
and disinfecting, and with the high degree of compliance with those things is why we're not seeing transmission in schools very much, which is great. We'd rather see none. I mean, I don't want to say that 1 or 2 is fine and acceptable. We really would prefer to see none. But when you compare that to other settings where we have cases of COVID-19 come into households or social gatherings or even workplaces, we're seeing much more transmission than we are in schools. So it looks like to us that schools being reopened are not contributing substantially to the increase in cases that we're seeing in the community.
Right. And I think from the standpoint of most superintendents, I think it's, they're finding keeping kids in school is, in a much more controlled environment sometimes is a benefit rather than having them out loose and, doing whatever.
Right. Learning pods, we all hear about the learning pods for students that are in distance learning or hybrid, and that's concerning because, those are less controlled environments than schools are. So when you have students who are getting together in somebody's home, what kind of controls are in place? Do homes have HVAC systems, central systems that can filter out, microbes in the environment? Mm-hmm. Are they cleaning and disinfecting vigorously? Are they keeping 6 feet of distance, mask wearing compliance? I mean, all those questions that we just don't have answers to because they're occurring outside of schools is concerning. So while I understand the anxiety of parents and educators about hearing and seeing students come into school and then finding out that they've tested positive and being told they were within 6 feet of you 15 minutes over that day and you need to quarantine is concerning. I certainly understand the anxiety, but on a population level, when you look at cases in our community, schools don't seem to be contributing substantially to what we're seeing in terms of the pandemic curve.
Sure.
That's good.
So difficult choices for educators when it comes to mental and behavioral health and people being worried and needing to keep schools open because education in person is better than education from a distance. And schools, the unique role they play in terms of providing a safe child care environment for young students so the parents can go to work. I mean, all of these things, schools hold a very unique place in our communities. And there are no great answers here, and I don't want to downplay anything about students coming into school and ultimately having COVID-19 and saying that's fine, don't worry about it. But it's just really a very difficult situation we're all in, educators included. So
absolutely.
It is okay to acknowledge that this is a once-in-a-100-year pandemic, and there may be things that overwhelm our ability and capacity to think of great solutions.
Sure.
It's okay to acknowledge that.
Absolutely. And I think from that standpoint, but we did get some good news this week, and I think from a standpoint of the vaccines, there's some really positive results coming out of some of the 3 big manufacturers. So hopefully that'll help stem the virus.
Yeah, well, the other thing I think that the announcement of the vaccines has done is I think it had a positive impact on the stock market. I think we saw the stock sort of surge a little bit after those announcements. But no, I mean, in terms of What's on the horizon? Absolutely thrilled to see that there are vaccines whose early data suggests that they are very efficacious, and that means that they are, they work to prevent people from getting sick, by and large, and that's great. Now, efficacy is different than effectiveness. Effectiveness really has to do with compliance and uptake in communities. Are they going to be effective in preventing community outbreaks and community transmission? That really relies on having an efficacious vaccine and people getting the vaccine when it's available. So if and when they become widely available, I will be encouraging everybody to get the vaccine if it's safe and effective, and there are no contraindications. And I will be in line to get that vaccine as soon as it comes down. So I'm certainly looking forward to that, although it will shift the operations of Chatham Health District pretty considerably, because we will be responsible, I think, largely for vaccinating members of our critical workforce groups in Portland and other towns. So
Sure.
Police, fire, EMS, boards of education, municipal employees. So we'll be engaged in that activity for probably quite a while when the vaccine becomes available. So certainly logistical challenges for the health department and trying to keep up with all the other work we have to do while adding vaccination to that list is something we'll be dealing with over the next few weeks, trying to figure out how we'll do all those things. But I think it's the most important effort that we will undertake during this entire pandemic.
One thing, Russ, that I hope with this pandemic, maybe a bright spot, maybe some of our young folks trying to determine a career path will consider public health. It's something that I know as a member of the Board of Health, you talk to us quite a bit about the need for recruitment of new public health career paths, people that are interested in doing the kind of work that you do.
I really hope so. I mean, if I had time to invite people to become interns with the health department right now, I would love to have a cadre of young, eager, college-age students looking for a career path to show them what it's like to work in public health during a pandemic. Though I don't want to scare them away. But certainly we do need people to consider public health as a career path, because the workforce has declined in recent years, and so it is challenging. But maybe you're right. I hadn't even thought about it. When the word public health and public health jargon like contact tracing, quarantine, and isolation gets thrown about and become colloquial, I think it's
household terms. I mean, we use it all the time now, and it is an exciting career, and I think it's something that's so very much needed. And certainly your background in epidemiology has been invaluable to us in Chatham Health District to be able to weather this horrific disease. And I want to thank you, first of all, and grateful for the fact that you've been trained in this area. We're very fortunate.
Sure. I don't think I ever envisioned having to go through a once-in-a-100-year pandemic.
Yeah.
When I took the job a year and a half ago. I thought I'd be learning about environmental health and dealing with, some budgets and some. Now, certainly sort of stumbling into this at a moment where epidemiology seems to be so important. Maybe it was meant to be.
That's right.
That's all
Absolutely.
Absolutely, for sure. For sure. Well, I think, the governor put that plea out with his press conferences this week on, engaging students and, healthcare workers, and as far as for, volunteering and, getting us through this, this whole, situation.
Yeah.
For sure. So anyway, all right. I think, Russ, again, thanks for all your invaluable information. As Susan said, I think you're definitely a huge asset, not only to the town of Portland, but throughout the Chatham Health District, and your knowledge and your willingness to jump in and give great information. And I think that's so helpful. And our listeners, I know when we have you on, our listens on our podcast definitely go up, so which is great.
Well, happy to get the opportunity to speak directly to people in Portland.
It's great.
So anyway, but just a food for thought. If you'd like to have your own podcast for Chatham Health, you know who to call.
One day when we're on the downside of this curve, we can have that conversation, Dave.
Fantastic. So, all right, Susan, anything else that you...
No, I think we're up to date. Just want to wish everybody once again a happy Thanksgiving and holiday season. Just take care of yourself, as we say every time we have one of these episodes, Dave. And I just know that we can get through it, and we certainly will. And keep the faith.
Again, and I just want to echo that, and from all of us here at the Town Tech Educational Partnership Studio. And again, we're going to be post-processing this episode and getting it on the Comcast Channel 15. And just click on the Portland website or wherever you get your podcast, and you can listen to this episode, as many as our other 26 episodes that we have cataloged on our podcast site. So until next week or the week after, depending on, have yourself a great Thanksgiving. And as I always say, please stay home, stay safe, wash your hands, and above all, wear your masks. So we'll see you next time. Thanks so much. Thank you for joining us today. I'm your host, Dave Kosminski. Please tune in every week for new and relevant conversations about the town of Portland. You can find us at portlandct.org or at YouTube/Town of Portland, and now wherever you listen to your podcasts. If you've enjoyed our podcast, please consider subscribing and sharing with friends. This podcast was produced by the Town Tech Educational Partnership Program, which is a partnership between Portland High School and the Portland Town Hall. If you're looking to start a podcast for your business or organization, check out towntech.org/podcast to learn more.